Hello, Dr. Frazier. How are you doing?
I'm doing great. How are you, Aaliyah?
I'm very well, thank you.
Nice to see you.
Nice to be seen. Thank you so much for coming. And could you share with us a little bit about your background?
Well, actually, historically, I'm from Virginia, and I moved here in 1990. Completed my residency. I worked at the Cancer Institute down in Detroit at Karmanos until about 2004, and then during that time, I was the residency program director for about the last 5 years before I left the Cancer Institute. And then I became the medical director of the Ted B. Wahby Cancer Center at McLaren Macomb Hospital in 2004. And basically the last 12 years, my practice has mainly been focused on that facility and coordinating the cancer care for patients in Macomb County.
Okay. So you've been treating cancer patients for a lot of years now. Can you just enlighten us to some of the changes that you've seen over the years in cancer care treatment?
Well, I think one of the big areas as a radiation oncologist, and so people might be coming in for 5 or 6 or 7 or 8 weeks of radiation. For some of the cancers that we deal with nowadays, we're using a shorter course of therapy, but we're delivering the maybe equivalent doses of radiation or maybe higher doses of radiation because we're using something called radiosurgery. So the technology kind of started changing between 2000 and 2005, and the computers allowed us to find a way to deliver the radiation more accurately. Some of the cancers that we deal with are in the different parts of the body that are maybe moving. So we have an issue with organ motion. So the prime example would be, like, let's say we have a 90-year-old person who comes in with lung cancer. Mm-hmm. They went for a chest x-ray, or they had a cough, and then they do a CAT scan, and they've got a tumor. They used to call it a coin lesion, like a tumor the size of a quarter. Mm-hmm. So the standard treatment would be to go in and remove the upper part of the lung, remove that piece of lung. But that could be a very involved surgery for an older person. So we used to treat people with 35 radiation treatments. So we would give them 7,000 units of radiation over about 6 to 7 weeks. But with the advent of radiosurgery, now we're actually giving much higher doses of than that, in the range of 10,000 units of radiation to that tumor in 1 week. So it's typically like 4 or 5 visits, 4 or 5 mm-hmm. treatments. And because the radiation is so focused, the risk of toxicity or complications is very low.
So what are the benefits for that patient? And then how does that take a toll, the treatment toll?
So the interesting thing is when you look at like protracted radiation for a patient with lung cancer, 7 weeks of radiation, the success rate was about 30%. Okay. So now with something like stereotactic radiosurgery, it's 1 week of treatment. It's more of a focused form of radiation, so you're staying away from the normal tissues. And the local control rate is between 95 and 97%.
Okay, so more successful, it sounds
So
like.
It's significant improvement. And I think the other area where things have really come along in the last 5 years is like targeted drugs, new drug therapies. Mm-hmm. Historically, chemotherapy, people would say, well, chemotherapy, you're treating the whole body, trying to kill cancer cells, but there maybe was a lot more side effects from that. And so nowadays what's happening is when we diagnose somebody with cancer, we actually test the genetics of the cancer cells to find out what is the most effective drug, or if they carry a gene that we can target with a drug. I think the prime example is melanoma. We have 4 or 5 blockbuster medications that have come out in the last 5 or 6 years for people with melanoma, but you have to test the genes in the melanoma to find out which drug is going to work.
So are those tests pretty accurate?
Oh, they're very accurate, okay. Because you send the tissue, and they do the genetic testing, and then you know if they have the gene. Mm. And if they have the gene, then you have it's like an antibody therapy. Okay. That's going to target those cancer cells. And by doing that, you're going to avoid a lot of side effects because you're only really going after the cancer cells. You're not going to have a lot of systemic side effects that people would think of when they think of those kind of treatments.
So with Karmanos being new to McLaren Macomb, What type of resources does Karmanos offer for McLaren Macomb?
So McLaren Macomb, the Ted B. Wahby Cancer Center, this was a vision that goes back maybe 15, 20 years. And when I came here in 2004, the hospital administration said, well, our goal is to have the #1 cancer center in Macomb County. And I think we have moved to that position. We have in 2007, we opened the cancer center, which is behind the hospital. And then just in the last couple weeks, what's happening is not only is our technology phenomenal, we are adding some additional personnel. In fact, next month we will have so we've been asking for genetic counseling for the last couple of years, and so we'll have genetic counseling starting in October, which will be wonderful because a lot of the patients that we see, they come in and they'll say, well, their mom had cancer, their dad had cancer, their uncle had cancer, some of their children have had cancer, and there's something else going on rather than, just bad luck. And so we need genetic counseling. We diagnose people with genetic problems with blood tests and so forth. I think having a genetic counselor on site is a major advantage. And other than that, it's pretty phenomenal if you see what's happening at the cancer center. We have what are called multidisciplinary tumor boards. We have tumor boards for breast cancer, gastrointestinal cancer, head and neck cancer, cancers like what we call genitourinary, like bladder cancer, prostate cancer. We have gynecologic oncology. Dr. Michael Hicks is our gynecologic oncologist, and we have our G1 oncology tumor board. But it's very coordinated. We have several other people that are involved because we have social workers on site, which is wonderful because, people under stress.
Right.
Society is already super stressful, and then you add health problems and family problems.
You need someone to talk to.
So we have phenomenal social work support, and then we just in the last 2 months, we have a dietitian on site. So we have dietitians, we have genetic counseling, social work, and it's all right there in the center. So it's just amazing.
So with that being said, in your opinion, what does the future of advancements in cancer look like?
So I think for the radiation therapy, radiation oncology, certainly more focused radiation, but there are other big areas that are very important. I think a lot of the future will be various forms of drug therapy, targeted drugs, monoclonal antibody therapies, and then vaccines. So it's phenomenal. I think where the future is going with oncology.
So cancers you're seeing more of recently?
Well, one of the things about McLaren Macomb Hospital, they have been very aggressive in the right kind of technology. We have some of the best mammography imaging equipment in the state of Michigan. One of our biggest growth areas has been breast cancer. Breast cancer is certainly been increasing as far as the diagnosis, but it's early stage patients because they come in for their imaging. We find the problem before it becomes a serious issue. Besides that, certainly the best time to be in oncology because of all the technology, the focused forms of treatment that we can deliver, the safer drugs, safer treatments, and it's really a very coordinated program, which makes it wonderful for the patients. We have a lot of people who come in and they're completely stressed out. We've got social work. We've got a lot of people helping to get these patients through the program.
You have been very insightful today, and thank you
thank you
so much for all of the great information for our viewers. Thank you so much, and have a wonderful day.
Thank you, Leah.
Okay. Thank you,
Appreciate
Dr. Frazier.
Thanks a lot.
Thank you.
To learn more about cancer care at McLaren Macomb, visit mclaren.org/Macomb Cancer.